Hello, my name is Luma Makari and I'm from Lebanon. I'm currently based in Beirut where I am working on Elgorithm, a nonprofit that provides schools with access to digital mental health programs. While I hadn't been around for the fall of the Berlin Wall, it is still symbolic to me because of the psychological as well as physical significance that it had in breaking boundaries and increasing cohesion by opening up an exchange of knowledge. The wall my project breaks is the stigma of mental health and its separation from all elements of our life. Mental health is one of the most important factors in determining our quality of life, overall health and well-being, yet we grow up without knowledge on how to navigate our mental health. The wall algorithm intends to continue collapsing is the vacuum that we collectively isolate mental health to as a global community. The challenge we address is the absence of mental health literacy in our education system. Algorithm's solution is to integrate mental health literacy into schools so that youth are equipped with a foundation of knowledge, skills, and practices to navigate their mental health. We do this through implementing our programs into schools that provide students with a combination of inner tools that they can always resort to, from cognitive behavioral therapy to mindfulness and social and emotional learning. The essential new findings of our research indicate that when youth are exposed to mental health in an educational context, stigma is reduced, and the fear of judgment or discomfort around seeking services also decreases. This has a ripple effect which also encourages others in the collective community to do the same. Similarly, exposure to mental health literacy in a school setting supports youth in building their internal toolbox of practices that work for them to navigate challenging situations that inevitably occur throughout their life. The way society can benefit from our research is by having increased access to mental health and destigmatizing conversations around it. A question that remains unanswered is how to incentivize governmental bodies to adopt mental health programs on a large scale, and how to engage them as key players in democratizing access to mental health services. The part of my research that keeps me lying awake at night is how we can prioritize mental health on a policy and nationwide strategy level. My hope for the future is to be able to democratize access to mental health tools and services, specifically for vulnerable and migrant communities that are faced with additional barriers to accessing such services.